I don't
Great.
know. We've got Matt, who's going to be the primary presenter today from CORE with his team. And at first, we'd like to go around and just do intros of everybody. So Eric Orelnik from Brigham Women's and Harvard Medical School in Ariadne. Margaret.
Hi, everyone. Margaret Benor, Assistant Director of Strategic Projects at Ariadne.
Amy.
Hi, everyone. Amy Carledge, Writing Specialist at Ariadne.
Steph.
Yes, Stephanie Shorel of Communications in the Communications Department of Ariadne.
Johanna.
Hi, everyone. I'm Johanna, and I've been an intern at Ariadne since the summer, working with the Mass Vaccination Site Collaborative.
Thanks, Johanna. Dasha.
Hi, everybody. I'm Dasha Migunoff with CORE, the Director of Technical Services. And Eric, can I jump into your flow for a second to introduce Jan and Matt? Great, thank you. So I wanted to introduce the two of them so that they are not too modest. Jan is our Deputy Area Director for about 4 of our areas, including Haiti. And Jan was our site manager at Dodger Stadium. So he is the mass vax expert if you have any questions for him about those operational details. And Matt McCoy was actually the deputy site manager. So you have 2 Dodger Stadium alumni joining us who also happen to have very deep experience with bringing those operations over to Haiti in Jan's case and to Brazil in Matt's case. So he'll be presenting more on that. Jan and Matt, I'll be quiet now so you can also say hello, introduce yourselves.
Hi, this is Jan. So can you guys hear me?
Yes.
Yeah, I'm not gonna add anything. Thank you, Dasha. That was really nice. So I'm in Chicago right now and just curious to listen to what Matt has to say. We worked together very hard for many months and we went through a few adventures. So that's it.
Great. Matt.
Hi, everyone. Good to see you all again. Sorry, again, my camera doesn't work on my computer, so you just get my voice today. My name is Matt McCoy. I work for CORE and I am the area manager and I handle all the vaccine operations that we do in Rio de Janeiro.
Great, Matt. Yeah, we're looking forward to hearing about all of the journeys you've gone through and your lessons learned. Yvonne.
Hi, everyone. Ivana Kukwe. I'm the manager of Global Learning and Engagement with the Boost community, the Sabin Vaccine Institute. So nice to see you all.
Yvonne. Dan.
Good afternoon, everyone. My name is Dan McElhinney. I'm the Deputy Federal Coordinating Officer for FEMA Region 1 for COVID. Bob Fogel introduced me and to this group and invited me to participate. So I participated on one call previously, and I'm glad to be able to join you again. Thank you.
Welcome, Dan. Thanks so much. Julie.
Sorry for coughing, so I apologize. I'm Julie Rosenberg. I work on vaccine delivery at Ariadne Labs. I'm the Associate Director of the Better Evidence Program, and we've been working on sort of building public-facing tools to help leaders incorporate evidence and data into making decisions about where to place sites and how to allocate vaccines. So glad to be here. Thanks.
Thanks, Julie. And Becky.
Hey everybody, it's Becky Fox. I'm the Chief Nurse and Informatics Officer at Atrium Health. And I'm glad to be with all of you talking about our favorite subject of vaccines today.
Great, thanks, Becky. I'll turn it back over to Margaret for any business before we jump into our presenters.
Thanks, Eric. I don't think there are any specific announcements or questions right now, but wondering if folks have any sort of any thoughts or questions or just insights around recent announcements around boosters and mix and match. Wondering if anyone wants to share something before we dive into our presentation.
I have something else to add, maybe for discussion at the end, not related to that topic, Margaret, but the resources for staff morale and how to continue to support staff during month 20 or whatever we're on, and mitigating burnout.
Dasha, that's such a timely comment because I was just emailing last night with Mary Brindle, who's the director of our Safe Surgery, Safe Systems program, but also sort of on the side has been supporting some work with colleagues in Mumbai around burnout and sort of mental health support. So we're hoping that we'll have Mary and the team that she's been working with in a meeting in the next coming weeks. So very timely.
Great. Yeah, it's a great topic, and thanks, Margaret, and for reaching out to Mary and Dasha for bringing up that topic. So let's move on to the presentation, and then we can circle back. Maybe that may spark some conversations. Lots of things happening, pediatrics, all that fun stuff. So great. I think we're going to turn it over now to Matt and Jan.
Can you guys hear me?
Yeah.
All right, perfect. Can you guys see my screen?
Yes.
Yes.
Perfect. All right, I'll go ahead and get started. So I will be presenting on CORE's Brazil COVID-19 vax response. So for those of you who don't know, CORE, or Community Organized Relief Effort, is a emergency response nonprofit that got its start in Haiti after the earthquake in 2010 and has maintained projects in Haiti ever since then. But in the beginning of the COVID-19 pandemic, they had started with testing in March 2020 in Los Angeles. And since then, testing operations expanded to a bunch of markets in the United States: Atlanta, Chicago, New Orleans, New York City, just to name a few, and other COVID-19 relief projects in places such as the Navajo Nation. So after a couple months of COVID-19 testing in the United States, it was just a natural transition to go into COVID-19 vaccinations. And that started in December 2020 with the vaccination of healthcare workers in Los Angeles. And then that expanded into our other markets that were doing testing as well. But this also brought in the opportunity for CORE to expand internationally. And we were able to expand into Brazil, Haiti, and India. So CORE landed in Rio in April 2021. And as of then, there were more than 70,000 new cases being reported daily. To that point, over 18 million cases reported, over 500,000 reported deaths. And as of October, that's over 600,000 now, just behind the US. And the initial vax response in Brazil wasn't a great one. The president of Brazil, Bolsonaro, did not take COVID-19 very seriously. He was a big proponent of nobody getting the vaccine, herd immunity, kind of just let the virus do what it needs to do and don't really intervene. So by the time vaccines started rolling out, the country wasn't very well prepared to roll it out. And that included not having enough vaccines in country, not having enough consumables, not having enough oxygen, things like that. And when CORE got here in April 2021, they had only really been vaccinating healthcare workers and elderly. And we're doing that with the CoronaVac and AstraZeneca vaccines. So I couldn't continue without mentioning our partners. CORE couldn't have done this without these partners. Direct Relief is a co-funder for all our operations here. Rio City Hall, the National Healthcare System, SUS, we couldn't do that. And Viva Rio is our biggest partner here, and they help us implement all our operations to make these vaccines possible in Rio de Janeiro. So Brazil is, by definition, a middle income country, but as I had mentioned, they didn't prepare themselves well for the mass vax of COVID-19. So where CORE fit in this picture was bringing in our technical and operational expertise from the United States. We came in and had the ability to help them build capacity, allow them to do more, take the vaccines outside of their community clinics, give feedback on operational flow, make things more efficient, provide technology and integrate technology into the way things were being done, and help them with the data management because everything was being registered on paper. So our initial start in Rio was with 4 vaccine sites. And we had strategically chosen these sites all across this huge city. It's a population of 6.5 million people. And we had a site pretty much in as far apart as we could make it. And we made these sites close to vulnerable low-income communities, trying to improve access and capacity in those areas. And after a month or so of operations, we kind of realized we did have the ability to expand even further, open up new sites, and be flexible and able to move around and kind of respond to the needs of the city as they were coming up. So as of October 2021, we have 7 vac sites operating, and that includes a big drive-through at the Olympic Park where some of the events in the Rio 2016 Olympics took place. We have a couple walk-ups in Samba schools, and we also have entered clinics and put sites directly right next to clinics that were facing a huge demand of people, and made it easy on the population by just putting our site directly right next to the clinic, so they could come and get vaccinated with us and let the clinic do what they need to do, the other services they provide. Our expansion and flexibility was a great asset to the health department, and they really appreciated everything that CORE was doing, and it allowed us to be invited for other sort of vaccination projects in Rio de Janeiro. So there was 2 vaccine campaigns that the health department launched. One was the Paquetá Island vaccination project, and then the Mare Favela vaccination project. So essentially, Paquetá Island is an island off the coast of Rio with a population of about 5,000 people. And the health department had just decided one weekend, we're just going to take a bunch of vaccines and vaccinate everyone, the entire adult population. And a part of that came with a serological study and studying how the virus spread amongst the island population after they were vaccinated. So CORE was able to participate in that by bringing in our vaccinators and some of our technology to make the process more efficient for them. And it was similar in the Mare Favela. Mare is a big complex of slums in Rio. And the idea, again, was just to vaccinate the entire adult population there and make it as easy as possible since it's a very dangerous slum. Just make it easy by vaccinating everyone at one time, and the health department doesn't have to worry about it after that. So after a couple months, CORE has administered over 300,000 vaccine doses to date. Those doses being AstraZeneca, Pfizer, CoronaVac, and a little bit of Johnson. And our lessons learned. So again, one of our successes was our flexibility and adaptability, being able to kind of respond to the needs of the city as they came, opening new sites, changing site locations, things of that such. And with that, it created a collaborative partnership with the city. We are in constant contact. We're strategizing, trying to figure out what's next, what needs to happen. So that has been a great success. And another success was high vaccine rates. In the beginning of the vaccine rollout in Brazil, there was a lot of mistrust around the COVID-19 vaccine. There's reports of people getting saline shots, reports of people not getting the correct vaccine. So that created a lot of mistrust in the beginning, but that hasn't stopped the Brazilian population from wanting to get vaccinated. And I just saw the data today that Rio de Janeiro, over 80% of the population now has completed both doses. So it's created a high vaccine rate. And you can see in this picture as well that because there was mistrust, a way that they combated this mistrust was showing the entire process of drawing the vaccine right in front of the patient. So the patient can actually see the vial of the vaccine, watch the vaccinator pull the vaccine, and then watch them inject it into their arm, so that it creates trust in the entire process. And then as for challenges, while we were able to provide technology and help with the data management aspect of vaccine registrations, it didn't come without its difficulties. People in the health department, especially people who have been working in the health department for years, liked their tried and true methods of just doing everything on paper, and then if needed, upload it into a paper later on. But CORE enabled them to have tablets right then and there, be able to register everything in the moment, so that way nothing was lost and it didn't have to be uploaded later, and there was no backlog. Challenges, the culture of behind the vaccine process. Like I said in the beginning, there was a lot of mistrust, but that eventually got better over time. And then another challenge has been the vaccine supply. The federal government has not been very good at ordering vaccines, providing vaccines to the municipalities. And as a consequence, the vaccine rollout has been very slow. The municipality of Rio doesn't get that many vaccines per week. So it really has lowered the city's capacity to vaccinate. And there's times where there's no vaccines in a day, and all vaccine operations have to wait until the federal government can provide the municipality with more vaccinations. So that was just a brief overview of what CORE has been doing with vaccines in Brazil. And that's it. Does anyone have any questions?
Go ahead, Steph.
I had a question. When you went into the island and the favela, you did it in a one-day thing. Do you know what the percentage was? What were you able to do in that day? Were you able to get, 90%, 80% in those days? Was it successful?
Yes, these projects took place over weekends. The Pakata Island was in June, and Mare was in a weekend in July. And for both of those projects, they were able to vaccinate over 90% of the population.
Wow.
The adult population over 18.
Mm-hmm. And the population, just curious about that, the population, they kind of stepped up, they were willing, or were you going door to door? I'm just curious, was there a willingness on the part of the population to get vaccinated?
Oh yes, these were big events. These weren't these were announced to the community. It was planned with the communities, especially in the favela. That's something that you need to talk to the community leaders beforehand. This isn't necessarily a safe area to just show up and unannounced. So these were very planned and people were excited about it.
Matt, when you say 90%, can you give us an idea of what that actually, the volume is?
For Paquetá, the island's population, entire population, I don't know what the adult population is exactly, but the entire population is about 5,500. So 90% of that, more or less. And then Mare, I believe, has a population of 30,000 people. And by July, a lot of people had already been vaccinated, because in July they were working on the 30-year-olds. So really, the biggest lift was vaccinating all the 30, 20-year-olds during that weekend.
And you talked about sort of the 7 vaccination sites, and a total of 300,000 to date. Can you give us an idea of that sort of, and you talked about drive-through versus walk-in. Can you talk a little bit more about sort of the different sites and the volumes at each site, like either daily, monthly, weekly, whatever sort of numbers are easiest, and maybe some of the general?
Yeah, of course. So our biggest site is the one at Olympic Park. That is the drive-through site. And right now it has 6 drive-through lanes that has the capacity to vaccinate about 1,500 people a day. So that is our biggest operation drive up, and that's our only drive up. Our second biggest is at the Republic Museum of Rio, and we have 10 vaccinators there that also have the capacity to do about 1,500 a day, and that is a walk up. And then we have other walk ups of varying capacity. The ones at the Samba School can do about 1,000 a day, and the one at our clinic is small, but they're mighty, and they all can do about 800 a day.
That's really impressive. So for your largest scale, the Olympic one, did you look at prior playbooks or utilize any of the prior work that had been done before you operationalized it, or was it sort of de novo?
So yeah, so this was a site that was kind of being built by the city prior to CORE's entrance, and of course CORE ran the Dodger Stadium site in Los Angeles, so we knew a thing or two about like massive drive-through vaccination sites. So one thing we were able to give our operational expertise on was the way they handled the cars. Initially, it was kind of like a free-for-all outside of the line, and the line was unclear. It backed up into weird places. So when I got there, I was able to kind of have conversations with the local traffic controllers and have them bring cones in and create like a little serpentine. So that way the line was extremely clear and it didn't create any sort of backup onto the roads.
That's great. The first part you described sounds like a normal day driving in Boston traffic. Well, I've asked a lot of questions. I know Julie had a question here in the chat. Julie, do you want to ask, or do you want me to read it?
Sure, I can ask. I was just curious. I mean, first, thanks for the presentation, and just an amazing effort, and the numbers are pretty astounding. So what a difference you guys are making. That's amazing. I'm really curious about how you decided and what informed exactly where to locate the sites. And then, you talked about being nimble and having to shift. How did you decide when to shift and who made those decisions? What kind of evidence did you draw on?
Right. So I had mentioned that we were helping the city with their data management. So there's actually a federal database, and it's the immunization database that they use. And since we were able to help them eliminate their backlog, we could actually see in real time how many vaccinations were being done by site and by clinic in the city. So we could kind of see where the demand was. Just for an example, one of the clinics that we work right next to is in a neighborhood called Pavuna, which is on the border of the Rio municipality. And since Rio is a more progressive and more advanced municipality, they're actually rolling out vaccines a lot faster than the surrounding municipality. But there's no rule preventing people from entering Rio and getting vaccinated. So what this did to this small clinic on the outskirts of Rio was create the biggest demand I've ever seen. The health department was actually, since it wasn't a core site, the health department was the one who kind of flagged it for us. And we did a preliminary visit to the site. And the moment I saw it, I was like, we need to help. You just imagine this tiny clinic with hundreds of people inside, dozens of people trying to get inside, and they're all there for the COVID-19 vaccine. So that's when we kind of core came in and brought in our resources and did what we need to do to get all those people outside the clinic and kind of relieve that demand and vaccinate there. And we're always monitoring the volume of vaccinations at our sites and what's going on in other parts of the city to kind of inform us where the flow is and where the demand is.
Okay, yeah, that's really helpful. So I was just curious if you kind of used demand or like where are the people that are not vaccinated to go to try to generate the demand? Because you're probably going to get different audiences at different sites. So that's helpful. And I'm just curious, what have your conversations about this been? Should you go where the people are versus where the demand is? And how does that sort of address different needs, I guess, and the trade-off?
Yes.
Like, what do you all think?
Yeah. So in the case of Rio, demand is thankfully high across the board. I think right now they have about 98% of the adult population, at least with their first dose. So across all demographics, the demand and the want for the vaccine is extremely high. So turnout is high. And the only place where the city wasn't sure how high the demand was actually the street population. So we worked with a branch within the health department that kind of deals with the health of the street population. And we enabled them with some human resources and some other materials to kind of go out and take to the streets and vaccinate the homeless population, educate the homeless population, and give vaccines out there.
Great, thank you.
I have, I think, one comment and one question. The comment is, I think it's really interesting and really important, Matt, what you were describing of there being some distrust, and so to try to overcome that and to build some vaccine confidence, actually having nurses or the vaccinators drawing up the vaccine right in front of the person before they get vaccinated. Because I think certainly in the mass vaccination earlier conversations, and then even extending to other sites, what we've talked a lot about is the importance of efficiency and moving quickly But I think here you've noted, sorry, there's a truck driving by. Here you've noted a really important trade-off that rather than having it drawn up earlier where it was not visible to the person getting vaccinated, taking that little extra time to show what you're doing to build their confidence. I think that's a really important trade-off that is helpful to note. My question now, you can respond to that. Sorry, I do have a question that's unrelated, but go ahead.
I was gonna say in response to that, yeah, I was talking with Dasha the other day about this, and the trade-off is certainly that the patient gets to see the entire process of the vaccine being applied. But in Brazil and Rio, there's actually no monitoring time after you're vaccinated. So once you get your shot, you can just walk away. So there's the trade-off in the efficiency is that, they don't have to wait after they're vaccinated, but the process of getting vaccinated takes a little longer.
Yeah, and I think, Margaret, just for background, I think part of it, and Matt, correct me if I'm wrong, but I've heard from others in Latin America, it's that they don't believe that what's going in, the trust issues are different, right? So, here it's about the production and the development and, sort of the R&D process, whereas there's a lot of mistrust around what exactly is going in my arm. Are you tricking me? Is this just water? I want the real thing. And so, I agree. It's a great that you can show them. And it's just such a different reason for mistrust that, it's too bad we can't take people into the labs, and here and show all the, clinical trial data and have them understand it. It's what a relief in some ways to be able to prove right before their very eyes, the thing they're most worried about. So
yeah, totally, Julie. I think it's really, again, it points to the people, or the reason that people are hesitant or unsure is not the same across the board, within a country or across countries. And it's really important to know the audience and then to be able to have strategies to address what is the specific concern for them. So yeah, totally agree. Wish that was more of our challenge here, where we could have shown them the process. So my question is on a totally unrelated piece, but Matt, you mentioned the government, the federal government not ordering enough vaccine, and I wonder, is that a challenge of supply chain? There just wasn't enough vaccine for the government to order at the time, or is it more a question of the procurement process, understanding what the need and the demand is and ordering to match it? Has there not been the right sort of data loops for that, or maybe both?
Right.
I don't know.
I think it's a little of both. I think in the initial response, it was political. The federal government truly just didn't want to prepare for this vaccination and the demand for the vaccines. But as time went on, the vaccine supply came, and then it just became an issue of the federal government supplying the municipalities with the vaccines. And that's the issue we're having today. Even just last week, the city of Rio has had to suspend vaccinations for a day, or close operations a little earlier because there's not enough in the municipality. So the country has the vaccines. Now it's just a matter of being supplied at the municipal level.
Mhm.
Thanks. That's helpful, Matt. Do others have
Other-
questions or comments?
Other questions?
I just want to reiterate what Margaret said. So basically, the federal government has the vaccines. There is the supply. It's a matter of dispersal within country. It's not a matter of getting it into country. It's a dispersal within country. Is that what you're saying?
Right now, yes.
Right now, okay.
Just last week, we've had to severely lower our capacity and what we're able to do. I mean, that drive-through site that I was talking about at the Olympic Park had a day where they were only able to give out 6 shots not because there wasn't any demand for the shots, it's just the tiers were restricted, and it just came down to, people, or it came down to supply.
Matt, we're sort of, oh, go ahead.
Sorry, lots of questions, but I'm curious, how about, if you could talk a little bit more about what it's been like working with the Ministry of Health, and sort of in parallel with them, and, just as what kind of political will there is and support, and, how you're able to make decisions versus them, and what that working relationship is like.
Right. So we don't have a direct relationship with the Federal Ministry of Health. We have a direct relationship with the Secretary of Health for the municipality of Rio. And essentially what it comes down to is that CORE can make operational decisions and the way things are run operationally. But when it comes to medical oversight, medical direction, and vaccine supply, that's purely at the decision of the Secretary of Health.
Okay.
Matt, I had a question around, we're sort of at this point where one of our objectives here is to leverage some of the lessons learned from our experience, primarily domestically, and bring that to bear to assist lower middle income countries around the world. Partnering with Boost, Yvonne's organization, the Bill and Melinda Gates Foundation, and others to work through this. And I'm curious what as someone who had worked in the States on these sites and then talked so eloquently about, you gave 2 really tangible examples at 2 different sites about sort of jumping in and applying some of what you had learned at Dodger Stadium, you gave as an example, to the Olympic Stadium. What are your sort of pearls, I guess, or sort of takeaways about, when people are aiming to translate some of these lessons from the US experience to the global experience? What are your initial thoughts?
I think there are a lot of similarities across the board, but I think you can't forget that even though CORE has a wealth of knowledge in operations and technical expertise from the United States, ultimately, when you're operating in another country, you kind of have to be willing to accept that not everything you can bring will manifest, because there's a culture, for the case of the technology integration, we definitely have had to make compromises. And if it were purely CORE's way, it would be a lot different. But we've had to kind of have conversations with the health department, the people we're working with in the clinics, and kind of make some compromises in the way that it runs. So I would always keep culture in mind.
Matt, that's so funny. I was taking some notes related to your presentation just now and the conversation that I had with you a couple of days ago about your operations and lessons, and culture was the word that I just jotted down. Because I agree. So I've had the pleasure of speaking to Matt and Jan about our Haiti operations, as well as a colleague in India, as part of case studies that we're developing to really finally document these lessons learned. And it really, again, like Matt said, so many of the operations are very, very similar. It's a pretty standard flow, but the local culture really determines some of the nuances and idiosyncrasies. So for example, in Haiti, in India, having a privacy screen for the patients is an essential part of the the vaccination site. That's not the case in Brazil. In Brazil and Haiti, there has been more reticence about using electronic data collection on site, whereas in India, that was picked up right away. So just like a lot of these little nuances that, like Matt was saying, are really determined by the local culture. And then secondly, I wanted to also highlight about bringing vaccines directly to people. Your question, Julie, about how to make that decision about bringing the vaccine directly to the people or based on demand. And with these particularly vulnerable populations, Jan has talked about this quite a bit as well, they just have other priorities. Getting a COVID vaccine is not at the top of their list of needs in life. And so people aren't going to go out of their way to go to a vaccination site to wait in line. So if it's a public health priority to get them vaccinated, the public health system needs to bring the vaccine to them, like literally door to door or to their place of work, because they're dealing with income, trying to live paycheck to paycheck and take care of their families. So it's a completely different model as far as the provision of this service.
Thanks, Tasha, for adding the extra context from Haiti and India.
That's great. Yeah, those are so many times culture is one of the first words that rings in people's ears when we think about any of these this translational work. So really helpful. Other questions?
I have one more, if folks will indulge me asking another question. Matt, I'm wondering if you can talk to us a little bit about the different roles, like the different types of people who are supporting these different vaccination sites. So, yes, there are probably nurses and physicians, but what are the more maybe surprising roles or like types of people that you've tapped into to make these sites work?
It's pretty similar to how CORE was running things in the United States. You got your scribes, the people who are, documenting and registering everything. And then you have your vaccinators. But one thing that I thought was particularly interesting in Brazil is that every vac site that we have it's an absolute essential, must come with cleaners. And there's people that just go around they just make their rounds across the site and just make sure everything is sanitized and clean. And I thought that was very interesting at first, because that's definitely not something that we had at Dodger Stadium. And, sanitation is definitely very important, but it was mostly the responsibility of the vaccinator or the scribe to be maintaining their own areas. But here in Rio, we actually have people roaming around, just constantly cleaning.
That is really interesting, and the difference between the U.S. for sure. Who are the people who are scribes? Like who qualifies? Who's eligible to serve as a scribe?
Anyone with a high school education is eligible to be a scribe. Essentially, that role is just collecting the person's ID, making sure that they're eligible, and then inputting them into that national health and immunization database that I was talking about. And then after that, they go to the vaccinator.
And how did you get folks for that? Well, two questions. Is that a paid position? Are they volunteers? And then how did you recruit those people?
Yes, good question. This is where our partner Viva Rio comes in. Viva Rio is a very well-known organization in Rio, especially for the health department. And essentially, they're 90% of what Viva Rio does is human resources. So they're very well known. People know to go to the Viva Rio website and look for job postings on health related positions, such as, you know, scribes in this vaccination project. And it is a paid position.
Awesome, thank you.
And Margaret, I can add a little bit about our model in India, and more to come in those case studies, but I just learned that we have staff who are responsible for registration and crowd control, but often at the mobile sites in the slums where we're operating, volunteers will come, and they're often affiliated with a particular political party or politician who wants to kind of show involvement in this process. And so the volunteers will come and they'll support the operations on the site, but with oversight from our staff.
Yeah, we have a little of that in Brazil here too. We actually have big samba fans who come up dressed completely in their favorite gear, and they help at the door and kind of hang around because they're just very proud for us to be in that space and help out.
It totally makes me think of CIC Health and their focus on the guest experience, right? Like having people in full samba attire, costume, and like welcoming people. That's great.
I kind of have to say I'm a little bit jealous.
Me too. My vaccination experience was very sterile.
Yeah.
I was at the hospital.
The lessons go both ways. We can bring those lessons from Brazil to the US.
I'm ready. I think the staff should have to wear samba outfits too. So I love it.
What do you think, Matt, like when we're talking about staffing, and I think Margaret was driving at this, in general, the people that are involved in these sites, what would you say the percentage or your general sense were actually involved in routine vaccine campaigns versus this is the first time they're, you know, working in this space? Maybe they have other healthcare roles, but this is the first time that they're actually working in the sort of mass vac space.
Right. So certainly this pandemic and this high demand for vaccines at this moment has created a demand for nurses and people that are eligible and able to vaccinate. So what ended up happening is that we have hired a lot of nurse technicians. So they're not exactly nurses, but they're still qualified to administer shots. So a lot of these people are inexperienced, but through this routine vaccination and just doing these shots every day has given them a lot of experience to, you know, move on and, you know, maybe get their nursing degree or do other things. But we've really, with Viva Rio, been a proponent of hiring people not too experienced, you know, and not in a bad way, but being able to use this experience in this vaccine campaign as a way to get experience in the healthcare field.
That's great. Any other questions for Matt, Dasha, Jan?
I'm just curious, what would make your efforts more successful in Brazil right now? What do you need? What would you like to see happen? If you could wave a wand.
I would say that we have been extremely successful, especially with this high vaccine turnout. So I don't think anything has happened to say that we haven't been successful. I just think we've been delayed in being successful. I think there have been some roadblocks along the way that have kind of slowed the process. But regardless, you know, we're still working on it. You know, it comes down to supply, but the supply is coming. So it's still in the horizon. Vaccine turnout has been high, and they're already working on booster shots for elderly people and healthcare workers. So we've been incredibly successful. It's just taken maybe a little bit longer than it should have.
That's a great question, Stephanie. I would also add, I think just continued and additional investment in the actual administration of the vaccines. I mean, obviously quite a bit of money has poured into the supply. of vaccine doses, but it's obviously a big, as everybody on this call knows, it's a big leap from the vaccine, from the getting the vial to the arm and the shot. And that there has not been as much investment at all in the operations internationally. And while a lot of these countries have more sophisticated immunization programs than the US, their health systems are already overwhelmed. They already don't have enough healthcare workers. So there needs to be more creativity and funding for non-clinical setting vaccination campaigns to do this quickly.
So
Thank you, Dasha.
Thank you very much. Just to follow up, so you feel like it's not a question that the supply isn't coming, it's a question of delay in the supply coming then?
Well, no, not just the supply, but also providing operational support to then administer that supply in countries.
Thank you.
Well, this has been really terrific, really unbelievable work. Matt and team leading this effort. I think we learned many different things about your operations and how that potentially could translate to other spaces, both back to the US and to other middle or lower middle income nations. So this is really just awesome. Things that are happening, we've sort of referenced this. I think we're close. We're submitting the grant today to team with Boost and the Gates Foundation, which will shift this collaborative more focused in a global direction. And so all of the work that you've been doing and serving as SMEs has been unbelievable. And I think that will hopefully, I think we'll have the opportunity to help other nations, just like Matt described in Brazil and other countries. So we're really excited about that. We've got some upcoming speakers scheduled for the next couple of weeks. So I'm going to turn it over to Margaret to talk about them, and hope everybody has a wonderful weekend. Margaret?
Yeah, just quickly, next Friday, instead of our usual 2 p.m. Eastern time, we will be meeting at 11 a.m. Eastern time, and we will be joined by John Calder, who is from Baringa. I keep wanting to say Bazinga, and that is definitely not the name of the organization. Baringa, they worked with the NHS in the UK to set up vaccination sites, so we're going to hear from them next week. And then in November, we will be hearing from our colleagues at Village Reach. First, they're going to talk to us in November about their vaccination efforts in Washington State. And then in December, we will hear from them again, date to TBD, but sometime in December, they're going to talk about their mass vaccination efforts in Cote d'Ivoire and the DRC. So the Washington State date is November 19th, and then December is TBD. There are some weeks open in November and December still. We will likely talk with Dr. Mary Brindle again, like I mentioned earlier at the beginning of the call, and her colleagues in Mumbai on their sort of provider burnout work that they have been doing. And I'm sure very soon, sometime in November, we are going to talk about pediatric rollout in the US. So anticipating that is going to get the final authorization sometime in the first week, maybe toward the end of the first week in November. So I'm sure that will be another topic for discussion. So lots of exciting stuff coming up, and can't wait to keep the conversation going.
Awesome. Well, everybody have a great weekend.
Thank you, guys. Have a great weekend,
Thanks,
everyone.
everyone.
Thank you,
Thank
Matt, so
you.
much.
Bye.